and welcome to Evidence-Based Health Coaching, the newest trend in patient engagement. This free webinar is being brought to you by the Home Health Quality Improvement National and the National Society of Health Coaches. During today's webinar, we have many exciting presenters that we'll hear from and content that will speak directly to your needs as a practitioner or stakeholder in home health. Our keynote address will be delivered by Melinda Huffman, the co-founder of the National Society of Health Coaches and the principal of Miller and Huffman Outcome Architects, Incorporated. A little after Melinda's presentation, we'll learn about the Home Health Quality Improvement National Campaign free evidence-based health coaching educational resources. That presentation will be delivered by our lead RN project coordinator, Eve Esslinger. Then, after Eve's presentation, you'll have a chance to submit your questions and comments for our keynote and panelist speakers. In order to submit your questions, it's really important that you email them to hhqi@wvmi.org. You can send your questions to hhqi@wvmi.org at any time during the presentation. We will have a section for Q&A, but you don't have to wait to submit them. So if at any point you hear a question or you have a comment that you would like to provide, please email it to hhqi@wvmi.org. We'll address as many questions as time will allow during today's webinar broadcast. For those questions that we're unable to get to, we'll keep track of your email address and follow up with you later. So that's questions and answers and what you'll hear on today's webinar. At this point, I'm very pleased to introduce today's keynote speaker, Melinda Huffman. Melinda is an author, writer, and nationally known speaker and is the co-founder of the National Society of Health Coaches, whose evidence-based health coach certification program is listed as #1 among the most popular programs in the United States. She conducts coach clinics nationwide in the areas of evidence-based health coaching, patient engagement, and motivational interviewing. She's a former director of nursing at Southern Tennessee Medical Center, a director of disease management for Amedisys, and director of nursing education for Montville College. Melinda has a BSN from UAB Birmingham and an MSN from the Catholic University of America in Washington, D.C. She's the author of the home care bestseller, Implementing Outcome-Based Home Care. Without further ado, I'm pleased to present you with today's keynote speaker, Melinda Huffman. Melinda?
Thank you, Shannon. I really appreciate being with you all this afternoon. I want to take just a moment for the attendees to note the two handouts that accompany this slide set. I think there is a link that will be available a little later. I think they were having just a little problem with the link, but please refer to these tools as I'll mention those briefly in this presentation. So if you have been able to print them, please keep them handy for that purpose. Dr. Rob Lamberts recently wrote an article that appeared in the healthcare blog, and that blog happens to have over 500,000 readers. It's primarily a physician-written blog. Other providers are asked to write from time to time, but it was entitled, Why Patient Engagement Really Does Matter and Why So Many People Are Getting It Wrong. We hear the words patient engagement almost on a daily basis, but honestly, most everyone will tell us we don't really know how to do it. They hear about the EMR being a possible way to engage better, putting a patient representative on a home care advisory board or a hospital board, bedside rounds, home care visit rounds, but they're still not really sure about exactly how to do it. Well, evidence-based health coaching is one of those ways, and we believe the real way to patient engagement. So let's look at the definition of patient engagement and evidence-based health coaching. If we could back up one slide. So what is evidence-based health coaching? It is skillful conversation. Now think about that. It is skillful conversation. Clinical strategy to actively and safely engage those patients and families. Here's the key. It's the conversation that taps into someone's own motivation to change health behavior and self-manage their health condition, with the end result being to improve outcomes and reduce healthcare costs. If you'll think for just a moment, we're going to be tapping into someone else's motivation, a patient's motivation, to help change that health behavior. It won't be just about what we're telling them to do. We're now engaging them to do, to act. And how do we go about doing this? It's been very, very exciting for us to help bring this to the home health community and the medical community, because it is definitely a different way of looking at our patient approach. Next slide, please. So what evidence-based health coaching is not? It is not counseling. It is not directing. It is not managing. Next slide. So why has health coaching emerged? Well, I think we would all agree that in most cases our traditional methods are not working very well. Now, have we had some success as clinicians in the past? Hey, absolutely, and we've done some wonderful things. But when we look at the incidence of diabetes continuing to go up and obesity continuing to go up, there's other things that we feel like, wow, we're spending a lot of money on health care, but we're really not making, as far as population health, a big bang for our buck. And there's a lot of reasons why this is happening, but we believe that health coaching is certainly one way to make a huge dent, and we've seen some wonderful successes with this. It's also emerged because attention is now focused on engagement. And how do we do that? And it definitely can improve outcomes. With the foundation in motivational interviewing, evidence-based health coaching approach, those results have included reduced hospitalization admissions, improved diet and exercise management, reduced health risks, and improved medication adherence. And that, I know, is something we all as clinicians are interested in knowing more about. Next slide, please. The premise of evidence-based health coaching is something that I really want you to think about, because it does require a paradigm shift in your thinking. Traditionally, 7 or 8 years ago in my practice, I was very much the director and the cheerleader. And we'll talk about that in just a moment, in terms of how we're all kind of focused in that way. But this paradigm shift is definitely a change of approach for how we're going to be dealing with patients and helping guide them to act upon some of the things that we would like to see them act upon as we have directed them in the past. Now we're going to find a new way to help make them and guide them to act. First of all, we've got to believe the patient and know that the patient's the real change agent. The patient is the one who's going to be calling in the middle of the night to either go to the ER or to call their home care nurse. They ultimately make that decision. And think about the time that we spend teaching and cajoling and writing notes on the refrigerator and all of those things. The bottom line, they are the real change agent, or the family in some cases. Now think about this. The values, beliefs, culture, our faith, our birth generation all affect a patient's healthcare decisions. It's important for you to remember, even as you think about your patient, think about yourself as well, because we've been patients too. In effect, we are them. That will give us more empathy. That also we are saying we need, because research has shown patients believe that we have a lot less empathy than we believe as clinicians that we show. The patient and the family are the experts in their own lives. To establish this real partnership that we'll be talking about, we have got to meet them halfway. It's not all about the information that we share. It's more about how this fits into the social context of their life. And we really haven't been in the past, traditionally, been tapping into that as a positive. So the paradigm shift from a director and giving information to a partner can really change the dynamics of our relationship with our patients and truly help foster behavior change. Next slide. So think about, why are we directors? Why? Why are we a director more than anything else? Well, we've been trained to be the experts. In short, we're the experts. And we've got so much knowledge we want to give, because we believe that as we've been taught all of these evidence-based interventions, that if you do these, then you'll be healthy. Next slide. Or attain an optimal level of health for you. So in traditional health teaching, and certainly the way I used to practice many years ago was I directed and I managed my patient population. I had a do these things kind of approach. Now think a moment. What kinds of things do we tell our patients to do? Next slide. And we're very good at this. Vaccinations, preventative screenings, medications, exercise, diet, adverse signs and symptoms, follow-up appointments, and the list goes on. Now think about it. In the course of your busy day or evening or even night, there's a lot of things we have to do. We're managing physician calls. We're managing how many visits. We've got admissions to do with our patient visits. It just goes on and on. So we're trying our best to squeeze in a certain amount of information. Next slide. We want you to do these things. And if you don't do these things, we have a label for you. Does anybody know what that label might be? It's non-compliant. Non-compliant. And no matter how big our audiences are or where these audiences are located, when we ask this question, everybody in the audience knows the answer and gives the same answer in unison. We have a label, and it's non-compliant. Next slide. So let's look at non-compliance very briefly. Look at the cost of medication non-compliance. It's $300+ billion a year now. Up to 83% of the patients as of 2011 admit they don't follow their treatment plan. 50% don't take their medication as prescribed or never start their regimen. Now, I want you to think about yourself for just a moment. When I ask the audience to raise their hand, and I would love to ask you all this now, and if you happen to be in the room with other people, I want you to look around. Raise your hand in your group if you have never started your regimen but had your medication prescribed, or maybe never have taken it as prescribed, or if you haven't followed your treatment plan. 99% of the time, we will see at least 75% that hold up their hand. So we truly are them. Next slide. So let's take a look at why we have this issue. Why don't people change behavior? Dr. Susan Butterworth at Oregon Health and Sciences University did a huge survey with thousands of people, and this is what they found. The survey, those people surveyed said, the reason I don't change behavior, values don't support the change. They don't think it's important to change. They don't think they can. They haven't worked through their ambivalence about it. They aren't ready for it. They don't have a good plan, and they don't have adequate social support, any or all of these things. Now, think for just a moment. There is something on the list that is missing because the survey didn't report it. There were no responses for this particular item. Lack of knowledge. The survey did not capture anyone who said, I don't know how. I don't have the knowledge. Next slide. The next slide should be the, okay, that's right. If you'll stay there for just a moment, thank you. When you haven't worked through your ambivalence about a change, it's because you feel at least two ways about it. If you would be so kind to look at your ambivalence tool, it's part of the handout that I shared. If you can think in just a moment, if you don't happen to have the tool with you, think for a moment of a behavior that you have wanted to change. Maybe exercise more, maybe stay on your diet better. But as an individual, what behavior would I like to change that I really haven't been able to? And then think of it in this way. Ambivalence is conflicting feelings. I feel two ways about this. I would do this. Let's take this for example. I would exercise more, but I get home late at night. I would stay on my diet more, but I love to cook, and my family really enjoys what I cook. There's one little three-letter word that creates a lot of the problem for us, and that's the but in the middle. When you think of this ambivalence tool, and we use this a lot in evidence-based health coaching with our patients, have them look, and for yourself, I would encourage you to do this. Just take a few seconds to write down the reasons why you have stayed as you are instead of changing your behavior. And on the other side, reasons why you should change your behavior. And what you will find is you will have as many reasons for changing, for the most part, that you have for not changing, for staying as is. That's what our patients are going through. There are so many reasons they have for not following through. Part of the reason is we haven't tapped into what's important to them to change. Next slide. Change is similar to an iceberg. I want you to think about this for just a moment, even if it's a medication change. A new home exercise program, it can be something major or even something minor, but something new requires a behavior change. 15% of an iceberg is visible above the water, but the driving force and behavior is just like that iceberg, where there's 85% of that iceberg is susceptible to different currents and flows. All you have to do is just think about the Titanic. When it came down, remember the story. The captain saw a little tip of that iceberg. Hey, this won't be a problem. I can steer the Titanic around it. When in fact, he had no idea of this massive piece of ice beneath that small surface that was showing that wrecked the ship and drowned hundreds and hundreds of people. So think about that. It's not just about telling our patients what to do. Through the social context of their life, they're making the decision as whether to follow through. Next slide. We have to begin to think of patients and families aside from an information receptacle. And I used to, I laugh at this now, but I think of my practice in the past. I was giving those patients and families information. And I looked back, and as I found this picture, I thought to myself, yep, that was me. I was leaned in, making my points, and looked at the patient, kind of staring in this glaze. And now I see it was almost like I was treating her as a receptacle or him. I was giving so much information that not only was she not able to maybe handle all that information or remember, even with the greatest handouts or booklets, but I may have been totally missing the mark for her. So we've got to strive to be interested in what they say and what we help them to say. So how well do I really listen? We've got to strive to be interested, not interesting. Next slide. The self-assessment that I have included for you as well, I encourage you to take that assessment for yourself. How well do I listen? And if you will be honest with yourself, check those items that describe how you listen today. Because quite honestly, I think as providers, we are not trained to be good listeners. We're trained to give information because we have the information to share, information that will help you to gain your optimal level of health or condition. And what we've missed, where we've missed the boat is we're not listening to what the patient has to say that can make all the difference in the world. So I encourage you to do the self-assessment, and when you have, take stock of those items that you feel like you really need to improve on, but have your friends or a close family member very honestly agree to also complete this assessment of your listening and compare the two. You'll be amazed what you will find out. We had someone email us the other day and said, quote, unquote, I feel so embarrassed after taking that self-assessment. I'm such a poor listener. I had no idea. So don't be surprised at what you find out. More importantly, use that as an opportunity to improve your listening skills. How I am with people, this is so important. The research has shown this. How I am with people, what I say, and more importantly, what I help them to say makes a difference in whether behavior change happens. And I want you to think about that. Research has shown in motivational interviewing of over 300 studies and 30 years of research, and we have used motivational interviewing as the cornerstone and the foundation of our evidence-based health coaching approach, that if we can engage someone to talk more about changing behavior, they are more likely to change. If we talk in ways that create resistance, and I call it angels unaware, and I'll show you some examples of that in a moment, then that individual, our patients and families, it will create some resistance. They won't necessarily show you anger. They won't necessarily show you displeasure. But what will happen is that they are internally resisting, and they will back away from the recommendation. Next slide. Let's very briefly look at the traditional versus health coaching. And we've already mentioned that in traditional, it's directing and managing. In health coaching, we move to a different approach totally, which is partnering and engaging. Partnering, meaning that we're going to meet our patient halfway. Now, I want you to think about when someone has literally partnered with you. Number one, you typically don't feel like that you're in control. You share that control. You share that control, and you meet them halfway. It takes two to make that particular item that you're working on happen. So let's look from a do these things, diet, exercise, be sure that you have your blood pressure checked every so often, to a partnering. Tell me the concerns you have about your high blood pressure. Remember, how you say it and what you say and what you get your patients or families to say can make a difference in whether behavior change happens. And look at this. Now, we have seen many times in home care documentation and others, do you have any concerns? And they believe that that's coaching. Do you have any concerns requires a yes-no response. Yes, no. We call that closed-ended. It takes the patient nowhere. What now? Are closed-ended questions important? Yes, and they are fact-finding. We use them a lot, but not for the purposes we have in the past. They have a very good place, but not the only place. When you have someone to tell you the concerns they have about it, it requires them to think and to really consider what they're going to say about that. If you give someone time to think for a moment, they will think back as to something that possibly is of concern to them. Next slide. So let's look at how evidence-based health coaching differs from our traditional approach. Look what happens when you partner and engage. We actively listen. It has been said that if we are talking 50% of the time or more, we are not engaging that patient. Now think about that. I know from my perspective, I probably did 80% of the talking. 50% of the talking. Our patients need to be 50%. And what does that say? 50-50. It's a true partnership. We empower them, and there's different skills you can use to empower that patient where they don't feel that you're taking all of the decision-making away, and they, in fact, are able to meet you and feel like that partner, believe their partner. Non-judgmental, and I would say that probably 100% of us feel that we're non-judgmental. But there's times when we're creating resistance unaware, when we are, but we're not, we just don't recognize it because we haven't been trained to know. Partnering, the patient's concerns come first. Now, I know exactly what that means when I'm saying, oh, my goodness, how do we fit that into a day that's already packed with visits, admissions, communications with the agency, communications with physicians, the skills that we perform in terms of all of the at the bedside and the home type skills. There's a lot to be said for that. But I want to try to encourage you, if you will try this, some of these things, just on a very, very basic level, you will be so pleased at the kinds of things that you're going to be seeing from your patients. Directing and managing what we do traditionally and what you might be doing today, giving advice. We're diagnosis-driven. We do the talking, and it's our agenda. We're very busy. We're time-constrained. We have a list of things to do. We're focused on that referral sheet and those diagnoses. Am I saying that's not important? Heavens no. That's where we base those clinical interventions and strategies. But to couple that with the conversational skills will mean everything to you. Let's take a look more at some differences. Next slide. Let's look at this conversation example. Patient makes a statement. I just don't think I'll be able to stay on this diabetic diet. Now, traditionally, and these are some responses that I know that I used to use, and we've had some other people tell us yes. So these are actual statements. Sure you can. You can do it, and we're here to help you. We're just a phone call or a visit away. The diet for diabetes management is very important. You have to keep your sugar under control because, you know, if you don't, you could lose your eyesight or you could even lose a limb. Oh, diabetic diets aren't so bad. You know, we should all eat like that. So what am I actually doing? I think I'm cheerleading. I think I'm trying to give them the attaboy. I used to be the best cheerleader that you could find in the agency. But what was I actually doing? I was totally neglecting the social context of how that patient sees what the diabetic diet might do in his life. So let's look at what an evidence-based health coaching response would be to that patient statement. Tell me what concerns you about it. Give them a little time to speak with you, to tell them, to think about what caused them to say that. Tell me what you understand about your meal plan. On a scale of 1 to 10, with 10 being extremely confident, how confident are you that you can stick with your meal plan? Why do you believe you're at a 3 instead of a 9? What would it take for you to be at a 9? You can see that those kinds of responses are getting more to the crux of what is creating the problem for the patient. It may not have anything to do with knowledge. He may have had a wonderful instruction from us, but there's other issues that are creating problems for him. In evidence-based health coaching, we mentioned motivational interviewing. Motivational interviewing being the foundation of what we do. It's so critical. It gives you necessary skills, and there are literally hundreds of skills in evidence-based health coaching where when patients respond in certain ways, when you've asked them to give you information about certain things, as these questions try to obtain, then you listen, you're taught to listen for cues, where the patient is in his stage of change. How do I create that environment through my conversation that will help tap into that patient's want to help come along with me, to help guide him in a more positive direction? Because remember, the science says the more you can get the patient to talk about change, the more likely they are to change. Now look at some of these traditional methods. Sure you can. You can do it. We're here to help you. When I totally dismiss what is going on for that patient that's an issue for them, that's causing that problem, and I don't help them to drill down to it and share it with me, I'm totally missing the mark. I'm totally missing the mark. Even though I tried to be the cheerleader, the truth is I didn't have the skill. So when we can recognize those cues, then there are cues to empower. There's also cues to know when a patient is resisting you and how to respond to decrease that resistance. With motivational interviewing, there's several different methods that are wonderful strategies. And I can share with you that we've had clinicians, whether they be in home care or occupational health or in hospital or wherever their setting is, that have shared with us, you know, in using these skills, I feel more like a clinician than I have in years. I never knew what this could do for the patient and for me professionally and personally. Next slide. Let's look at the first clinical model of health coaching in the nation. The National Society of Health Coaches proposed this model and have it available for those who want to do studies with the approach or to simply have a framework by which to practice. Let's take a moment just to look. You see we have the health coach and the client or the patient that is equally giving to this partnership. In a spirit of partnering, we goal set together. We use the client's agenda. And some people feel very uncomfortable with using the client's agenda because they believe they're going to let go of what's important to them. But that's what we've got to begin to get comfortable in doing, is letting go enough where we can then begin to find out what is really creating the issues for that patient. Remember, the patient brings to the table their beliefs, their values and concerns, their culture, their birth generation, and in our education and training program, we go into how to use someone's birth generation to begin to have an idea of how they like to communicate and what behaviors you're likely to see, not black and white by any means, but what you may see that you can incorporate as you're working with these individuals. And you'll see what they also bring to the table, accountability for self-management, and the foundation being motivational interviewing that we are using. All of this model then generates health behavior outcomes that we can measure, and there's certainly several health coaching outcomes that can be measured. I never think of a patient satisfaction as not important. Your satisfaction, the patient's satisfaction with this approach is extremely critical in being able to ascertain how effective are we helping to generate certain outcomes through that health coaching method. The last slide, please. How do I obtain the skills of evidence-based health coaching that actively engage patients? I've mentioned that there are a host of skills that help empower your patient and the family, that help to converse with that patient and family so that you feel very comfortable in getting the information that you need in order to guide them to move forward. And the key is to tap into their want to, their action. It's not all about us anymore. It's meeting them halfway and ascertaining what they can bring to the conversation that will help them to be more likely to act in a more positive way. But we're very glad to help you. We have programs to help clinicians. It's been developed by clinicians for clinicians, and we're more than happy to help guide you if you're looking for this training, even for your agency. Thank you so much. I have enjoyed being with you. Thank you again, Home Health Quality Insights, for inviting me, and I will turn it back over to you all for questions.
Thank you, Melinda. This is Eva Slinger, and I'm going to be going over some resources that we have available through the campaign, free resources to help you with coaching. And this will be just a few minutes, and then we're going to open it up for questions so you can ask Melinda questions at that time. I am the lead RN project coordinator for the campaign, and all the resources that I'm going to be going over are from the campaign. So we'll go to the next slide. And what I'm going to be doing is sharing with you some of our best practice intervention package resources. And to do that, I'm going to go back in time a little bit, and we're currently in phase 3 of the campaign. But some of these packages are from a previous phase, phase 2, so are from like 2010, 2011, but they are still very current and very appropriate. They're all located in the same place, which is homehealthquality.org. And once you go to best practices, you just kind of will see, once you scroll over that, a whole group of the best practice intervention packages, the BPIPs, come up, and you just select them. To make this easy, what I thought I would do is to tell you specific resources in the packages that will help you with coaching. The first one is from Cross-Setting 1 BPIP, and that focused on care transitions and coaching. And what I'm going to share with you right now from this package is not so much resources, but evidence and information from the experts. We call this a focus section within the package. It's a large package, and this is a separate section. It's in the package or as a separate document. But in this, and you can find it easily, is information from Dr. Brock, who is from the Colorado Foundation for Medical Care, on community-based efforts to reduce hospital readmissions. And she has a section in her excerpt talking about what a motivated agency can do, and talks about health coaching, and also talks about the care transitions intervention in her section, and how home health agencies can use coaching to help their patients and help their outcomes. And then we also have from Sherry Latimer from the National Transitions of Care Coalition, a excerpt on care transitions and mention of coaching within that excerpt. We have information from Dr. Anderson from the Health Science Institute on evidence-based health coaching, a lever for better health outcomes. Again, really focused on coaching this section. And the other section that I wanted to call your attention to is from Melinda Huffman again. I'm going to actually share two excerpts that our speaker today and how she's contributed to the packages. And this is on telephonic coaching. Is it effective? I'd really encourage you to look at that. For those of you that can see this screen, you'll see that I do have the page numbers where you can find them. All you need to do is go to that package to find those specific excerpts. And then we'll go to the next slide. And we're going to be looking at cross-setting 2 best practice intervention package, again from phase 2, and this from 2011, still very timely and appropriate. And this particular package dealt with the chronic care model, disease management, so of course coaching is very important. What I will tell you is a little different than giving you page numbers is if you go to this package on the website, and you'll click on that package, and each best practice intervention package has its own web page. You'll open up that web page and keep scrolling. You'll see lots and lots of resources. Some of the resources that you're going to find are these My Action Plans. Action planning, very important to coaching. We have several versions available and also several languages available in these versions. So you've got a number of resources there. Those are for patients, and we hope you take advantage of them. My Action Plan. I'm going to bring that up again later in another package. Also in cross-setting 2, we had a whole group of kind of a toolkit that we had developed and then also updated for this particular package on heart failure, diabetes, and COPD, dealing with disease management. And then staff education, patient self-care workbooks, and the clinician decision support tool. All this made up this group of packages dealing with disease management and telehealth. So those are really great tools that I'd encourage you to take advantage of. And then we're going to move to the next slide, and we're going to go into a more recent package. It was a focus package. I know I just a few minutes ago mentioned the focus section. This is different. The whole package is focused. It's a more turnkey package. It's distinct, contains almost all the tools within it. Now, you do lose the content to a degree, but most agencies love these focus packages because they're very easy to use. Almost everything's within the package. The package is fairly short, and you will find a few extra things on the web page, but most things are right in the package. So what do we have here for coaching? You'll see I have the page numbers, information on individual motivation, patient activation, action planning again. I had said I would bring that up again. This is an action planning tool right in the package. And then also, you heard Melinda mention several times, motivational interviewing. We had a motivational interviewing tool, and we provided on the web a really nice pocket card you can use for staff education. Next slide, please. And then that brings us to a package that was developed for underserved populations. And that would be, for example, you do eligible populations. All of this is certainly information you can use with other populations. It's specifically designed, though, for underserved and to help you with patients that are underserved. This is a large package, lots of information, lots of resources. We have a whole section on health literacy. This included TeachBack and several TeachBack resources. Also, section on patient adherence, You can see two of the tools that we have in this package on the screen, and one being I know, I can, I will. I'm going to bring that up again. That's been a real popular tool that we've used multiple times, modifying it for specific packages. Next slide, please. And then we have the Focus Medication Management BPIP. That is a package, and we've talked about medication management so much. This was more of a focus package dealing with medication adherence, medication knowledge, and medication reconciliation. Specifically with coaching, we think about medication adherence. There was a tool for that, and also a tool on guiding patients toward medication adherence. We also had a patient-friendly medication schedule, so important, so that they can follow and have, a very clear example of how they need to take their medications. Next slide, please. We recently posted two packages specific to cardiovascular health. The first package was on blood pressure control and aspirin as appropriate. The package that I'm sharing with you now for coaching resources is on cholesterol management and smoking cessation. The tools that I'd encourage you to use to help with coaching are listed here. My questions about my heart with my doctor, taking control of your cholesterol, and then behavioral counseling for smoking cessation. And I also have another tool from Melinda who helped with this package on how to actively engage patients to change behaviors. So I'd encourage you to look for that. Next slide, please. And this is the last package that I'm going to be going over, but I'm going to tell you a little bit about one coming up here in just a moment. We have two disease management packages. One was on diabetes. It's a focus package. We just posted that a couple of weeks ago, and we have it outlined as just a few tools. One of the tools is for patients. It's called My Diabetes Education Workbook. It's a long tool following everything through their diabetes. It's a very nice workbook. To accompany that, we have a clinical evidence-based practice tool, and it's for the clinician. We have links and resources for the clinician to kind of back up that My Diabetes Education Workbook. So they kind of flow together, and they do. They're a nice guide for the clinician when they're working with the patient. We have another I Know, I Can, I Will. Remember, I said I would mention that again, specific to diabetes, and a diabetes stoplight tool. Next slide, please. And the next slide is on heart failure BPIP, and it is going to be released on April 1st, and it will mimic its kind of part 2, first on diabetes and now on heart failure. We are working hard on that, and we'll have some tools pictured for you that will be in that package. Next slide, please. And I wanted to tell you now, and I hope that all of you can mark this on your calendars, for Tuesday, April 29th, we're going to have another webinar on the gravity of falls, evidence-based preventative strategies. You'll see an outline and also the speakers on your screen. We will have more information, a flyer or registration open later about this webinar, but please note that it is coming up. And at this point, I'm going to turn the webinar back over to Shannon for questions. Shannon?
Thank you so much, Eve. We really appreciate all of those excellent resources that the Home Health Quality Improvement National Campaign has to offer. We're now up to the Q&A portion of today's session. And at this point, we will accept questions at HHQI@WVMI.org. Hold for one moment while I check the queue. All right, our first question comes from Tanya in Kansas, who would like for Melinda to explain how health coaching can apply to patients with cardiovascular issues. Melinda, could you explain that for us, please?
Sure. Thank you for your question. The beauty about the approach for evidence-based health coaching is that it can be used in any setting with any age group other than children, of course, because it has not been tested in children. You have to look at the child development side of that. But it's non-diagnosis specific. When you look at all of the different tools that can be used in evidence-based health coaching, they're applicable regardless of condition or diagnosis.
Excellent. Thank you so much, Melinda. Next question we have is for Eve, and it's in reference to the HHQI coaching resources. This question asks Eve, is there any cost for downloading these materials, and can they be adapted for our home health agency?
There is no cost. We do ask that you register on our website. Everything's free, though, and you certainly can download them. What you do is kind of up to you. We certainly appreciate if you note that, where you retrieve that tool, but you certainly can adapt them. That would be, we encourage that. Thanks.
Thank you so much, Eve. As we look through here our question queue, please, if you have any questions or comments, send them to hhqi@wvmi.org at any time. Right now we have our next question, which is similar to the first, and this asks about health coaching in reference to patients, ironically, who suffer from diabetes. So, yeah. Melinda, could you address that as well?
It would be the same answer, actually. That's the beauty of health coaching. Any condition, I would say, with reservation about the setting of the nursing home. Anyone, of course, who would have dementia or some type of issues, conditions that would involve their ability to converse intellectually and to take charge of some of their own health, that would be difficult in that case. But otherwise, diabetes, congestive failure, any of the other chronic types of conditions, you can use health coaching in.
Excellent. Thank you so much, Melinda. Next up, we have a comment, and this comes from Nancy in Florida. And Nancy says, thank you so much, Melinda. This was such a helpful webinar, and I now understand health coaching much better. Particularly loved the examples.
Great. Thank you.
All right. Next question comes in to us. This is for Eve, and this person would like an explanation of what a BPIP is.
Oh, okay. I'm sorry. I guess I didn't explain. A BPIP is a best practice intervention package. It's kind of our hallmark. It's the cornerstone of our resources here at the campaign. We do model them somewhat in the same fashion. What we do is look at evidence-based practices and build on those to develop resources and tools, many of them turnkey that you can use right away, many of them resources that you can use for education. Something we've done a lot with the last packages is develop bulletin board text or test text so that you can very easily just modify those to your own needs. So I guess just to be a little more succinct, we look at evidence-based practices and incorporate those in a package on a specific topic or topics for you to use at your agency.
Thank you so much for that explanation, Eve. This next question comes from Lauren in Denver, and I'll address this one myself. This question asks, has this webinar been recorded, and will it be available to replay on an on-demand basis? And Lauren, I can tell you, yes, we are recording today's session. It will be available by the end of the week by going to www.homehealthquality.org and looking under the Webinars tab. We will have a link there where you can either stream a recording of the webinar through WebEx or even download it if you have the WebEx ARF player. So it will be recorded, archived, and available online indefinitely along with the slides and the handout. We go back to the questions now, and the next one asks, did this material build on the chronic care model and incorporate some of the principles? And that would be for Melinda.
Not the chronic care model in particular that you're referring to, although in our definition of evidence-based health coaching, you may recall on that first slide, we talked about skillful conversation and clinical strategy. So we pull into the conversation, of course, that kind of information on evidence-based practice for the chronic condition management, anything that would relate to the management of the condition from that perspective, but not the chronic condition model per se, although we are familiar with that model. I guess the other thing about evidence-based health coaching that would be important to mention is you can use, we tend to think of this as the vehicle through which any discharge model could be implemented or any chronic condition model could be implemented. It's very usable, very user-friendly.
Excellent. Thank you so much, Melinda. As we go back into our queue now, and this question says, this is from Debbie, who says, Melinda, thank you so much for the great presentation. And that was one question, comment we'd actually gotten to. This is the one I was looking for. Are there studies that show if coaching improves outcomes, such as lower readmission?
Yes, there are. In terms of the motivational interviewing component, I can send those to you if you would like.
Okay. Well, we'll track those questions as they come in.
Okay.
We have another excellent comment that comes to us from Frank, and Frank is in Oregon. Frank just also echoes the earlier sentiments of what a great set of examples that you used in today's presentation. He says it really helped him understand much better how to implement these coaching models themselves.
Well, thank you.
Our next question comes from Celeste, who asks, do you offer MI training to groups?
Yes, we do. And we do actually have discounts for groups. If you can email us, the info@nshcoa.com, or you can email me directly. I believe that is on the handout. I'm happy to provide you with more information.
Sounds good. Well, unless anyone else has a question or comment, we have a few more moments. If you would like to get one in, please send them to hhqi@wvmi.org via email before we wrap up today's session. And in looking, I believe that wraps up today's Q&A portion of evidence-based health coaching, the newest trend in patient engagement. Well, on behalf of the Home Health Quality Improvement National Campaign, we would like to thank you for joining today's free webinar broadcast. This presentation was a joint presentation of both the Home Health Quality Improvement National Campaign and the National Society of Health Coaches. As mentioned, this information will be archived online, so please visit www.homehealthquality.org soon to check out the handouts and recording of today's session. Again, thank you for joining us today. We appreciate your participation and look forward to talking with you soon. Have a great afternoon. Goodbye.